Osteoarthritis and Fixing Knee Pain, SID RX. Right here I'm showing you the two different types of valgus, internal rotation and external rotation. One thing you don't want to be is overweight, because that will cause damage. And the other thing you don't want to do is do poor exercises like half squats with weighted bars, because that will damage your knees as well. So right here, I'm showing you something that's just absolutely critical, and that's stretching. This is a hamstring stretch. You want to hold it for about 20 seconds, and you want to do it several times a day. Every stretch that you want to do several times a day. Right here is a calf stretch that I'm just about to do, just against the wall. Now you want to keep the back foot heel on the floor. You do not want to raise it, and you don't want to have your toe out. Right here is a quad stretch, and you just want to hold the knee, and you don't want it to turn outwards or inwards for that matter. So now once you've done the stretch, take a ball, any kind of ball, squishy ball preferably, and squeeze it between your knees and squat downwards. This will strengthen the knee. And then notice I have a medicine ball. I'm going to do actually a wall ball squat. You want to have knees hip width apart, and you don't want to bend your knees forward too much. Right here, I'm raising my leg, then bringing it back down. This is good for mobility, and it actually does strengthen the knee, believe it or not. You can use a resistance band if your knee is feeling good enough, but don't do it if your knee hurts. Do this several times a day, about 10 reps. Right here I'm on my side and raising my leg. This will also help with the ventral gluteal and your weak VMO muscle, and it will help the knee pain go. So right here I'm using a shirt actually, but you can use anything, a towel or a resistance band, and just move your knee back and forth. Make sure you have the mobility so that you can keep that mobility, because once you have osteoarthritis, daily activities can get difficult. So it's really good to have this. This is right here the open clamshell. You can also do a monster walk, but yeah, this will strengthen your VMO muscle, and then knee pain should be even less.